Hi, my name is Joe Pine, and my presentation for exercise 46 is on stress and anxiety disorders. So, to get started, what are stress and anxiety disorders? So, anxiety disorders, they are defined as disorders that refer to multiple mental or physiological phenomena. Now, these phenomena include a person's conscious state of worry over a future unwanted event or fear of an actual situation. Anxiety and fear are closely related, and more on that later on. Stress is defined in a medical or biological context as a physical, mental, or emotional factor that causes bodily or mental tension. Now, these stressors can be external or internal. Examples of external stressors are stressors from the environment, physiological factors, or social situations. The internal factors and stressors are either from illnesses or medical procedures. Now, stress, what it does is it initiates the fight or flight response, which is a complex reaction of neurologic and endocrinologic systems, which release adrenaline in your body, which causes you to either you fight back, you run away, or you freeze. So, as you can see from this table below, stress has a bunch of factors on your body, on your mood, and on your behavior. On your body, you can experience headaches, muscle tension or pain, chest pain, fatigue, change in sex drive, upset stomach, sleep problems. On your mood, you can experience anxiety, restlessness, lack of motivation or focus, irritability or anger, sadness or depression. And on your behavior, you can overeat or undereat. A person has angry outbursts, they use tobacco, they use drugs and alcohol, and they experience social withdrawal. So, some examples of anxiety disorders. Now, panic disorder is characterized by spontaneous panic attacks. Generalized anxiety disorder is a disorder where there's a pattern of excessive worry on most days for a period lasting 6 months or longer, and this worry is very difficult to control. Social anxiety disorder is exactly what it sounds like it is. It's extreme fear in social situations with strangers. And these people only like being in environments with people they know. They don't like going out because they don't like being near strangers. Separation anxiety disorder is extreme anxiety about being separated from home or an individual. This is mostly seen in children that are, when they are separated from their parents because they don't understand that nothing's going to happen to their parents when they're away from them. They feel like they'll never see them again. OCD, or obsessive compulsive disorder, is recurrent, persistent, intrusive, anxiety-provoking thoughts, obsessions, which are obsessions, or repetitive acts, which are compulsions that a person feels driven to perform. So these people, sometimes they need to wash their hands 3 times after doing something messy, and they have to do this every time. Or some people like fold their shirts a certain way. There's a bunch of different things that these people do. PTSD or post-traumatic stress disorder. It follows exposure to trauma in the form of a frightening event, and an individual develops a recurrent re-experiencing of the event, so they basically have nightmares. And this disorder is mostly seen in combat veterans or people that are currently in combat. And specific phobias. They are marked and excessive fears for a specific object, and when they're exposed to that object, they experience extreme anxiety because of it. An example of these disorders are phobia of heights, flying, spiders, etc. So, the diagnostic criteria. For all these diseases, panic attacks are the number one thing that pops up in all of them. So, according to the DSM-5, criteria for panic attack is 4 or more of the following symptoms. And these symptoms are palpitations, pounding heart or accelerated heart rate, sweating, trembling or shaking, feeling of choking, chest pain or discomfort, nausea or abdominal distress, feeling dizzy, unsteady, lightheaded, or faint, chills or heat sensations, paresthesia, derealization, fear of losing control or going crazy, and the last one is fear of dying. And you can see from this graph that it defines what a panic attack is again. So it says a panic attack: heart pounding, sweating, trembling, air hunger, smothering, chest pain, stomach pain, nausea, dizziness, tingling, numbness of the feet, hands, feeling flushed, feeling chilled. And it basically says when you experience a panic attack, for the first part, you feel like you're having a heart attack. Then you start to think, am I going crazy? And the longer it lasts, they start to feel like they're actually like dying. So, treatment. The most effective treatment for most anxiety disorders is cognitive behavioral therapy, or CBT. Cognitive behavioral therapy, or CBT, is a common type of talk therapy, which is also known as psychotherapy. And what you do is you will work with a mental health counselor, psychotherapist, or therapist in a structured way, and you attend basically a limited number of sessions. In these sessions, CBT helps you become aware of inaccurate or negative thinking so you can view challenging situations more clearly and respond to them in a more effective way. So basically, what the therapist wants you to do is think more positively about certain situations and less negatively about them. And what they'll do sometimes is they'll expose you to the things slowly that you are afraid of. Like for specific phobias, if you fear like heights, they'll put you in like a simulator thing, and you'll like experience the height where you're not actually up that high, but you'll get used to it over time. And if CBT doesn't work, or sometimes they'll do this and CBT, is they'll give you medications. Now these medications include benzodiazepines, which an example of a benzodiazepine is Ativan, and SSRIs, which are serotonin reuptake inhibitors. And examples of these are Prozac and Paxil. And you can see examples of SSRIs in the table below and what they do. So how does exercise help? The feeling of being stressed can be triggered by an event that makes you feel frustrated or nervous. Anxiety is a feeling of fear, worry, or unease. It can be a reaction to stress, so stress and anxiety are interrelated, or it can occur in people who are unable to identify significant stressors in their lives. And basically what exercise does, it alleviates all of these problems because it helps you divert your mind and your focus into something else, so you feel a lot more relaxed and you feel better afterwards. So exercising with these disorders are very important because the mind and body are interconnected. When the mind is stressed, the body will be as well, and vice versa. So exercise, which is either aerobic resistance training or flexibility, decreases tension, it boosts your mood, makes you feel better, and it also eliminates anxiety by affecting some of the chemicals that make you feel either sad, depressed, anxious in your body, and it boosts your mood while doing that as well. So, contraindications to exercise. The contraindications for exercising with stress and anxiety disorders are one that pertain to other conditions that people may have. Since stress and anxiety disorders primarily have to do with the mind, there are really no physical limitations. So when you are prescribing exercise, you would basically look and see if the person has any other existing diseases, and you would tailor your exercise prescription to those diseases rather than to the psychological disorders. So if they have a condition, you would follow the ASM guidelines or CDD-4 depending on what condition they have. If you do not have any existing disorders, you would follow the ACSM guidelines for apparently healthy individuals if there is no other underlying conditions. Okay, so for my case study. Buddy the Elf is a 32-year-old male that suffers from excessive anxiety and worry about making toys in the North Pole. He has difficulty controlling these worries, and it sometimes affects him while he is working. based on these symptoms, Buddy would be classified with generalized anxiety disorder, which is, it falls under the broader category of anxiety disorders. So Buddy has not been previously working out, and he has no other existing conditions and no family history of anything else. Now, for risk stratification, since Buddy is 32 years old, age would not be a risk because he is a male and he is not over 40. For family history, since there were no previous family history of any cardiovascular diseases or anything else, that is not a risk. He is not a smoker. Since he was sedentary, that is a risk. He has no obesity risk factor, no hypertension, no dyslipidemia, and no prediabetes. With the given information, Buddy would be placed in a low risk category because he only has one of the risk factors of all the ones that are listed here. For exercise testing, we're going to follow the normal ACSM testing protocols if no other physical ailment is present. So for aerobic tests, we would test him by doing the 1 mile walk test or the Bruce treadmill test, and you would pick either one. You don't have to do them both. Really, you only have to do like one test for each of the specific categories. For resistance training, he could do either the hand grip strength test using the hand grip dynamometer, or he could do a 1 RM bench press test. And for flexibility, he can do the sit and reach. Okay, for exercise prescription, cardiovascular. For aerobic exercise, for frequency, he's going to do that 3 to 4 days per week, and he's going to work to get up to 5 to get the most benefits. He's going to do this at a moderate to vigorous intensity. He's going to do this for a time of 30 to 60 minutes per session, and the type of exercise will be rhythmic exercise using large muscle groups. So that would be either riding a bike, he could run, he could even ski since, he's up in the North Pole and it's cold this time of year. Or really, any time of year. For exercise prescription, for resistance training, for resistance exercise, he's going to do the frequency of 2 days a week with a day of rest in between, and he can work up to 3 days per week. For an intensity, he's going to do moderate intensity, which is 10 to 15 reps. He's going to do 2 to 3 sets with all major muscle groups, and since he's a beginner, he's going to start with machines, and he's going to gradually progress to free weights. And for flexibility, he's going to do this for 2 to 3 days per week. His stretches should be held for 10 to 30 seconds per stretch to the point of slight discomfort. He's going to repeat this 2 to 4 times, accumulating 60 seconds per stretch. And the type will be static, dynamic, ballistic, and PNF stretching are all effective. And basically, the best example of this is yoga, which you can see from the picture. And some of the poses are locust, crescent lunge, tree, Lord of the Dance, revolve side angle, cow, cat, and child's pose. And here are my references. Thanks for watching.